Hi, I'm Dana Sanneman. I'm the Executive Director of Public Affairs here at Mount Sinai South Nassau. I'm here braving the elements outside with Dr. Janet Kahn-Scolaro, the Administrative Director of Behavioral Health, Family Medicine, and Internal Medicine here at the hospital. We're standing in front of the Mount Sinai South Nassau Triage Tents that opened on Monday. The Triage Tents are seeing patients between 11 a.m. and 11 p.m. It is not a COVID testing site, but it's a place where people can come and if they're feeling any symptoms of COVID. So I just want to I brought Janet out here outside today just to talk a little bit about managing anxiety. Everyone's inside with your kids, you feel stressed, but I want Janet to kind of walk us through the different kinds of anxiety that people might feel and how we might be able to manage that at home and when maybe you should go seek professional help. So Janet, this has been referred to as the new normal.
Right.
So is it natural to feel some kind of anxiety about COVID-19?
So, of course, yes. It's natural to feel anxiety. You should feel anxiety. Anxiety is a signal that there's danger. And it forces us to do something about that, to get into a safe place, to hide if we have to. In essence, to shelter in place. However, when people talk about the new normal, I think we really have to rethink that idea. There's nothing new or normal about this situation. It changes every day. So we're not able to get used to a new normal because every day something's different. There's something new added. Today we can wear masks. So to say it's the new normal, it's just one step in a long journey.
Right. So what are some of the things people can do to help cope with the changes that COVID-19 has made to their daily life?
So there's a lot of advice out there. You can go on website after website. Great advice. Structure your day, clean your closets, enjoy your family. I worry a little bit that leaves people feeling like they're not even good at staying home. I'm not even staying home correctly, right? So I'm bad at that. So take it slow. Do the best you can, number one. The advice is wonderful if you can do it. But do understand that many people are just finding their way through. This was a situation that no one planned for and no one could plan for.
Right. So for some people, these fears from COVID-19 have really caused reactions that are out of character for them. So what's some of the reasoning behind that? Why has that happened to some people?
So we call it an acute stress reaction. When one's ability to cope overwhelms their coping. And so symptoms develop. Not sleeping, not eating correctly, feeling keyed up or irritable, even doing things, behaviors like that are out of character for them. For example, banging doors or slamming windows, things like that. They may have rapid heartbeat. They may have tingling in their fingers. All different signs and symptoms that are really just caused by a physiological reaction to stress.
So this is the acute stress disorder that we are speaking about.
Right.
So what are some of the other signs, behavioral signs maybe, or more physical signs?
So, in terms of behavior, we worry that sleep is the number one issue. People don't sleep, or they sleep way too much and feel very lethargic or foggy.
Right.
Oftentimes, that's your body's way of trying to tune out the stress.
So if you're binge watching something on Netflix and you're up all night, your body still needs to be able to
That's
adjust.
right.
Okay.
That's right. You may not feel tired until the next day or 2 days later, and it may hit you.
Right.
So be very careful about that kind of thing.
So just talk to us a little bit more specifically about some of the signs that people can look for. Like when is it okay, the signs that you're seeking, that when it's okay, and when might you want to seek additional help?
So we believe that we don't want people to wait until their functioning has deteriorated, until they're breaking plates and slamming doors. We want people to seek out assistance way before that, to get some advice, to get some ear to talk to be able to lower their reactivity. Every tip, every tool is great, but it's not great for everyone. So sometimes it's very helpful to talk to someone who can figure out what's going to be right for you. Meditation works for some people. Meditation makes symptoms way worse for other people.
Right.
So we really need to work out a plan that's right for the individual and their circumstances.
Right.
So don't wait until it's too bad.
So So right now, parents are home with their kids. You know, oftentimes families are home inside together all day long on the weekends. But kids can really also be dealing with some of this anxiety, and they show maybe some different reactions than adults do. Just talk a little bit about what symptoms kids could have.
So when you're looking at children, you're looking at them through a developmental lens all the time. Number one, very young children. Young children regress very easily. So we need to be aware that sometimes a kid that's been potty trained will start to wet the bed. Children will get fussy with their eating. They feel the temperature in the house change. You know, school-age children, they need the structure. That's the best advice, right? They need some structure. There is none right now.
Right.
So the best we can do is to give them enough information to help them feel helpful. They need to feel helpful. They need to, at their level, understand what they can do to make things better. And then we need to give all of ourselves some grace, particularly with our teenagers who normally are a tad irritable and maybe argumentative. You might see a lot more of that now.
Right. So what advice could you give parents when dealing with their kids at home? I mean, we all have the news on a lot. Kids are obviously hearing things on the news. Is that okay? How do you walk them through it and talk to them about it?
So I would limit my children's exposure to news. So there's a thing that happens where you only hear the worst, right? So you have this cognitive bias. You hear the worst thing, and that is what you think is real. Children have the same cognitive bias. We need to make sure that we balance. Yes, there have been deaths, but there have also been so many people who have recovered. And at the hospital, we see that, but the news doesn't always report that.
Right.
So we need to be very careful. Children can fill in the blanks, and their ideas could be worse than reality.
Now, I wanted to mention that Janet's been with Mount Sinai South Nassau for over 25 years. So she's helped this community, our community here at the hospital, through many crises. She's here through 9/11, through Sandy. This is another crisis for us, and this community has been resilient. We're able to bounce back. And
Absolutely.
So just talk to us a little bit about how should adults and kids manage some of their symptoms.
Okay, so the first thing is to take it slow. Take it slow. Have some grace. You're not going to be the poster child for how to survive this the best. You may not start your own charity, right? and that's what the news would have us think is the best way to cope.
Right.
Just take it slow. Have some grace. Have some forgiveness for yourself and for your kids, that you're not always going to do things perfectly. I do not know how to homeschool my children.
Right.
I don't know
either.
Dana. So this is all new for all of us.
Right.
Have some grace.
Okay.
Number one.
So acute stress disorder does usually resolve itself. Let's just talk about, this isn't going to just come to an abrupt end. It's going to be a slow situation, once we reach the peak, a slow decline.
Yes.
So it usually does resolve itself, but just talk us through, once we do get to the end of this, what would happen? What can we expect?
I was talking to a colleague, and so I'm a history buff, right? So this is much like London during the Blitzkrieg, 57 days, right, of bombing, 57 days. So we don't know when it's going to end. We just know in retrospect that that's what that was. And we know then that you have to pace yourself, that you have to put yourself on a guide that allows you to have some small increments of, I can get through this week, I can get through next week. And we'll see what happens, because every week it's going to change.
Right.
Every week it's going to be different. And you kind of have to say, okay, I'm going to stress out over this, but maybe I'm going to let this go.
Right.
I don't need to clean my closets. It's okay.
Right. And it's not a new normal.
And it's not a new normal.
So we talked, you said meditation's not for everyone.
Not for everybody.
What are some other, if meditation doesn't work for you, what are some other tips on both exercise or eating, anything that you can do? What are some tips that you can give?
Sure. So I like to help people when they're looking to meditate or when they're looking to find some inner peace. Mindfulness activities are very helpful. We were talking to the staff last week because they're very stressed and very busy. You can do a mindfulness activity in the elevator between the second and third floor. It doesn't have to be a 20-minute meditation.
Right.
Mindfulness activities, there are apps, and certainly someone can walk it through you over the phone. It helps you to just be aware of where you are and how you're feeling in the moment. and it could bring you from a 10 down to a 5. And that may be better for someone than one of the symptoms of acute stress disorder is lack of concentration.
Right.
So all this great advice about reading a book and catching up on all that, it's not good if your concentration is shot. So small bits of time, maybe 2-3 minutes of going through an exercise with an app or a person can be very helpful in just lowering your reactivity.
Okay, great. I think we did open it up to our Facebook audience for questions. Okay. So all these great tips that you've shared, I think, have been really helpful for the community. Again, if someone is feeling overwhelmed and they're not able to manage their stress, can you just give them some advice where they can go on our website to find more information?
So anyone can just call our counseling center at 377-5400.
Okay.
And the receptionist will put you through to a mental health provider who can talk to you a little bit. On the website soon there'll be a community number where you can call 24/7 and seek some immediate understanding, advice, help.
Okay, great. And again, our website is southnassau.org. We have a dedicated COVID page on there. You can also follow us on all of our social media channels at Mount Sinai South Nassau. And we'll have some more tips coming from Janet and our other experts in the coming weeks.
Thank you.
Thank you so much for your time. This is Dr. Janet Kahn-Scolaro.
Thank you, Dana.